You don't have to waste too much time. You answer question, just read it from the back. It's a select or apply. You don't have to answer everything. You pick those that you're confident. If you know only two, you just pick it and you move on. Then you get to find the buzzword. Which action by the nurse, an action that the nurse does, indicate further teaching. That means doing something wrong by the charge nurse, right? A new graduate is caring for a client who needs total parental nutrition, TPN. Then you go with your buzzwords, TPN, action, and further teaching. What is your content? Now go for your content. You can't just answer it. You have to go with your content. What do I know about TPN before even look at the answer choice? I know TPN should be infused via central line. This is good. TPN should be infused via a dedicated line. That's why we use central line. Central line has multiple ports. You can choose one dedicated line and you go through. When you stop the TPN, you need D10 to infuse to prevent hypoglycemia. So this is good. Infuse TPN as a piggyback. No, it's not a piggyback. It's a slow problem. It takes a while, sometimes 24 hours, 18 hours for you to infuse a total TPN. So this need further teaching, right? Monitor electrolytes. You got to check the individual electrolytes. So this is good. So there's only one answer there. If you pick more than one, 0 points. So select those that you're confident and ignore those that you don't know. Don't over-select. Once again, over-selection, you're better off not picking those that you know and not over-selecting and losing points, right? Number 2. Same thing. Which of the following finding the new graduate should expect? Select or apply. I should expect. That means expected finding. A new graduate is preparing to admit a client with a new diagnosis of what? Intussusception. Go with your buzzword. Understand what this intussusception is and put it together and said, okay, I know what they're going to trap me with, right? They're going to trap me in pyloric stenosis, right? Projectile emesis. Their emesis is not projectile, right? The emesis is bilious. They don't have olive-shaped mass, do they? Right? They don't have olive-shaped mass, so it's not consistent with the disease process. Right? What do they have? Right? You got to figure out that olive-shaped mass is consistent with the pyloric stenosis, right? Mucoid blood things too. It's consistent with the intussusception, and they have colic abdominal pain. Their pain is not consistent. It's not constant, right? It's not constant. It just come and go. So the right answer is like 2 bilious emesis, mucoid stool, that is cardiac stool, and colic abdominal pain. Projectile emesis is usually pyloric stenosis, and then olive-shaped mass is pyloric stenosis. But that's what your board will trap you with. Expected finding is what we've selected. Number 3. Which of the following will make the nurse question the prescription? That means something is wrong. There is contraindication, right? It's a select or apply. You don't need to pick everything once again. And nurse is caring for a client with what? Stroke-like symptoms in the emergency room, ready to receive alteplase. Buzzword, select or apply. Question it, alteplase. Stroke. If you have stroke, it's ischemic stroke, you will need alteplase. What are the indication? Abdominal surgery 4 weeks ago. That's good. It should be greater than 2 weeks. Head injury 6 months ago. It should be greater than 3 months. Atrial venous malformation is bad. Issue of uncontrolled hypertension is bad. Symptoms onset 5 hours is bad. It has to be 4.5 hours. Therefore, those are the one. The next question, 3, 4, 5. Is your question because that's not, that's contraindication for giving those medications. So the nurse need to be smart and just pick on those information. Which of the following findings require immediate intervention? That means something is bad and I need to intervene. These are all prioritization. If you want to master prioritization, check B sharp. Unexpected finding and expected finding. But if you don't see that, which of these is going to kill this patient? And this is doing assessment on a new client with diagnosis of what? Acute appendicitis. I look at it, itis, infection, white count 20,000. I'm not going to worry about it. Right lower quadrant pain on palpation on the left side. That is Rovsey sign, consistent with appendicitis. I'm not worried about it. But like abdomen, I don't expect it in acute appendicitis. So this is my answer. Temperature 101.5, I see an itis. It's expected finding. Why should you let number one trap you? Why should you let number four trap you? And why should you let number two trap you? Those are all expected finding. If you need to master your content, check adapt and close. But these are all what they put there. And you will pick it. You say, oh, 20,000, I'm picking it. Wrong answer. Prioritization 101, right? Prioritization 101. A nurse is caring for a client who is receiving what? Reteplase. I don't know what it is, but I look at the last name, I saw a place. I know that this is thrombolytic, right? For ischemic stroke, at least I've given you some idea. The client developed new onset right-sided weakness. Test-taking strategy, as you'll be doing right now. Prioritization, getting thrombolytic, and I have a new onset right-sided weakness. I should be getting better. Why now I have right-sided weakness is not expected. Therefore, I need to do something. Perform complete neurological exam. This is a neurological exam. She has weakness. What complete neurological exam is going to do to you right now? Provide oxygen. Fine. Oxygen is a trap. It's not going to help this patient right now. Rapid response team versus checking for stool. I know the patient is going to bleed. He's already bleeding in his head. Checking for stool in the blood blood is irrelevant. You need to let the doctor know we have a new finding. Patient is stroking in the head. Rapid response team will help you take care of the patient. But oxygen is not going to solve that problem. So number 3 is your right answer. It's a test-taking strategy and thinking about the process and prioritization 101. This is the only thing that I'm going to save this patient is a new provider at the bedside trying to figure it out. And number 6, a nurse is performing newborn assessment. A bluish, you see, buzzword. Discoloration of the feet was noted, but what? The rest of the abdomen, the body was pink. That means they have just acra cyanosis. The central cyanosis is good. There's no cyanosis in central. That means there's no pathological problem. It's the content, right? No pathological problem. Therefore, which action is appropriate? Skin to skin for the mother to warm the baby. Cover the feet with gloves is less efficient compared to mommy warming the baby. Check the sacral area for TAF. This is non-spinal bifida. And listen to the kid's heart. This is not tetralogy or Foley. I say central area is fine. Therefore, that's not the right answer. Number 1 is your best friend. I'm just showing you how to answer questions. This, like I said, this is a video I was going to make for my on demand, and I said I'll share it to you. But that's the way I will have done it anyway, just doing the questions and showing you key things you need to approach it. If you decide to watch the video, you stop it and you watch it and see what I say. Select or apply. Once again, a nurse is providing teaching to a new graduate. Which of the following the nurse should include in the teaching to be consistent with the diagnosis below? Some of the question may seem hard because I said it, but that's the idea, is the content, right? Which finding consistent with PAD or PVD? Think about it. You have to know what PAD or PVD is. 1, too much blood going to your leg, and 1, there's no blood. That's all, simple way. If you have too much blood, you get edema. If there's no blood, your nail will not grow. You get thicker. If you have less blood, then the skin becomes skinny. If there's too much blood, your pulses will be normal. Too much blood, you get varicose vein. Less blood, you get ulcer. This question you should not get it wrong. PAD and PVD is done. I mean, I know there's so many videos out there. They will make it so difficult. One word, blood flow. You see, that's what I used to answer the question, blood flow. And I look at each of the answer choice and I said, blood flow. And if there's no blood, well, I expect that. And One single word. That's all. The nurse is provided teaching to a client receiving external beam radiation after skincare after skincare. So this should have been. Which of the following statement made by the client indicate the need for further teaching? So the key fact is patient is receiving external beam radiation for skincare, right? He's talking about teaching them about skincare, right? Which of these indicate correct understanding? When you're getting radiation, there's certain things you have to tell the patient. They should wear loose fitting, right? No teaching. Okay. I will clean the skin with the warm but not hot, tepid, and mild soap. No teaching is needed, right? I wear what? Long sleeves and hat when outside to prevent sunburn. I will use sunscreen factor 15%. This is too low. You want the best one, 30. Anything greater than 30 is good. And I will avoid extreme temperatures. Cold or warm is bad. So no further teaching. So the only one that is needed is number 3. No, number 4. Postmortem care to a client who died from massive MI after being admitted for pneumonia. Which of the following actions are appropriate? This is a good case to test your test-taking strategy. You don't jump the gun. You wait to figure out what is going on with the patient before you answer the question. The nurse is performing postpartum, right? He died from myocardial infarction. What was the diagnosis of admission? Pneumonia. So this is an unexpected death. We're not expecting him from dying from MI. He came in with pneumonia. If he died from sepsis, yeah, but not MI. Therefore, this is unexpected. Most of the time, there will be autopsy. And so you should anticipate that they have to do certain things. So you have to know postmortem care. So you have to distinguish whether there's autopsy or not. This most likely there will be autopsy. So keep the dentures in place. It's inappropriate. Place client in the supine position. No. His face is going to discolorize. So elevate the head. So this is not appropriate. Close the eyes gently. That is good. Remove all IV lines. No. It's inappropriate. They may be doing an autopsy. We got to make sure, did he get any medication before he died? Yeah. Remove Foley. Don't remove any drains. Fold towel under the chin. Yes, to keep the mouth closed. So these are some of the things you have to do. I have a bunch of videos on postmortem care. You can check at NCLEX. A nurse is providing teaching to a client with what? Chronic kidney disease. That's your buzzword, CKD, right? Which of the following statement by the client indicate need for further teaching? If you have problem answering questions, you should watch the way I approach them. The words, I don't pay too much attention to words. That's the key buzzwords, right? Chronic kidney statements that indicate further teaching. So that's my eyes is focusing on it. Chronic kidney disease indicate further teaching. That means wrong thing. And it's selected apply. I'm not going to pick everything. I will avoid processed food. Good. Sodium. I will restrict my fluid intake. Good. Not too much fluid. I will count gelatin as a liquid. Excellent. Everybody forget. Gelatin, anything that melts. If you eat something that can melt and turn into liquid, renal failure patients should count as their fluid restriction, like popsicles and gelatin. Yeah. Stay on high protein diet. No, that will cause uremia, and that is a problem. Avoid potassium rich food. That's good. So number 4 is a problem. You need further teaching. NS is providing teaching to a new graduate on L&D rotation about measures to prevent newborn abduction in the nursery. Which of the following the nursery, including the teaching? So let it apply. I said this in the way to teach, like I said, for my people who subscribe for the on-demand. This is all the things you need to know to prevent abduction. Educate parents about the risks. Use of identically numbered band for the baby and the parent. Colored photo on the of the infant, and providers wear colored photo. All the nurses and their badges on. You see, you should avoid documenting your baby birth on social media so that nobody will come and steal it. Okay, the postpartum and nursery should be gated, and then use abduction system, alarm system, and the infant security tag. So all of this is indicated. These are the teaching should be improved. This is the way to avoid abduction, stealing babies. I don't know why. A nurse is preparing to admit a client with a new diagnosis of varicella infection. Client lesions are open. Which of the following infections control protocol are indicated? You got to master infection control. So if you need help, check adapting class or join our review class. I made it easy. 1, varicella. 2, lesion. And you know varicella is what? Airborne. But the lesions are open and therefore contact also. So which of these involve airborne and contact? Negative pressure room, airborne, right? Nurse wear surgical mask. You're going to get infected. Don't do that. You wear N95. Client wear N95 for X-ray. No, client wear surgical mask. Nurse wear gown, non-sterile gloves for routine care. This is wrong, okay? You got to wear N95 in addition. You can't just wear gown and gloves. You got to wear gown, gloves, and N95. That means gown, gloves is for the contact, N95 is for the airborne. So you may likely to choose this, but it's incomplete. For routine care, you have to wear the complete PPE. And a complete PPE require gown, gloves, and N95. Client door, close at all time. So 1 and 5 are your right answers. Number 13, a nurse is caring for 4 clients. Which client is at risk for megaloblastic anemia is the highest? Megaloblastic anemia is the key. And what is that? It's vitamin B12 deficiency. Who has vitamin B12 deficiency? All of them, but they substituting. Client on fortified cereal, usually cereals like vitamin B12 in it. Vegetarian, but it can take over, that means eggs. You will get some form of vitamin B12. Vegetarian, but it can take some milk, vitamin B12. Pure vegetarian, good luck with that. You're not going to get any vitamin B12 from your plant and protein. So number 1 is your right answer. Number 14, a charge nurse is caring for 5 clients with CHF exacerbation. Which client is a priority? You know, prioritization 101 is, like I said, you have to be sharp, but not an expected finding. And if all of them are expected finding, you got to pick the one that is going to kill the patient. They have given you words, CHF. So CHF, we all have CHF. Therefore, my BMP is going to go up. It's not the problem. Definition of CHF. I have CHF. My leg is going to have edema. I have CHF. I'm going to get some 4 pounds in 2 days. Use 1 to and close to 3 pounds in 1 to 2 days, or 5 pounds in a week. Is bad. But if I have a pink fruity sputum, I'm drowning. If I have S3, I have really bad. I'm in shock right now, cardiogenic. Basically, my heart is not pumping. So, pink fruity sputum and an S3 gallop is bad form of CHF. And those are the ones that should be your priority. So 4 and 5 are dangerous. 1 and 3 are not. So 4 and 5. And this is caring for a client diagnosed with serotonin syndrome. Which of the following findings support the diagnosis of the condition? You don't have to memorize it. Serotonin syndrome. Somebody taking some serotonin and had serotonin to that. And therefore, everything is up. You don't have to memorize. Everything is going up. You see, I keep on drawing up. I look at the answer choice. If it's going up, I'm picking it. Clunus, you're going up. Areflexis, I'm going down. Diaphoresis, I'm going up. Bradycardia, I'm going down. And then this is content 101. Temperature 104 is going up, right? I intentionally put it there in order for you, in case you see somewhere, nobody trap you. Serotonin syndrome, although everything is going up, the temperature goes up, it will never get to 104. If it goes to 104, it's neuroleptic malignant syndrome or malignant hyperthermia. If you want to know the difference, check out that class or join our review. But this 104 is unexpected finding in the serotonin syndrome. The temperature will be like 101.5. It doesn't go past that. So, and you should know probably 102, but when it get to 103, 104, no, it can't be serotonin syndrome. So 1, 3 are your right answer. 4 is wrong. Number 16, NS is observing a client with a left ankle fracture using crutches. Which of the following action need immediate intervention? Well, you got to know safety, some form of safety. Left ankle fracture, and you're using crutches, right? Well, the key is your leg doesn't work. So you cannot move the fractured leg without the crutches. So crutches now become the fractured leg. So crutches and fractured legs move together. They have to move together. So that's your friend, right? This is select or apply. So you look at the situation, advance first, the affected leg and the crutches together upstairs. You go up with the good leg. If you go in with your crutches and the this, you're going to fall down. So go up with the what? The good leg. The crutches and the affected leg are not the good leg. So which one need immediate intervention? This one. Bearing weight on your arms and your hands is good. Your elbow at 25 to 30 is good. You assume a 3-point stand is always good. And the crutches are 15 centimeter apart is always good. One answer. Over selection, give you 0. Don't do that. Master the content and you'll be able to figure out this. A nurse is caring for a client with pneumonia. Pneumonia, right? The nurse noted declining oxygen saturation. Which of the following uh, uh, the nurse first action? So it should have been nurse, not nest, right? So what is the nurse first action? So the nurse first action. Watch for this word every time. Best and first. First action, it just temporarily fix the problem. It's never the best. This patient oxygen is dropping, right? You can give them oxygen, but it's not going to completely make the patient feel better, right? If their position is bad, the oxygen is not going to improve. The first thing you can do, you can elevate the patient leg, head up. But the best answer is applying oxygen. Example, if you laying down and you desaturating, I'd rather get oxygen because I'm hypoxic rather than lift my head up. But if I'm desaturating and the first thing you can do to help with the situation, I can lift your head up. That's the first thing, but it's never the best. So watch this, okay? Watch that. When I say first, it's the least you can do for this patient. So even though oxygen here, no. Intubation is no. Listening to the lung is no. I just elevate their head up and see if they improved, okay? But if I say what is the best action, I will pick oxygen. And next is caring for a client with what? Emphysema. Which of the following is consistent with the diagnosis? You ask yourself, there's two things they're going to trap me, emphysema or bronchitis. Whenever you see that. One, the lung are big. The other, the lung is not that big. One, lung trapping. Other one, excessive secretion. Air trapping is emphysema. The air trapping creates bullae. That's the pocket of the lung. And this bullae can rupture. It becomes spontaneous pneumothorax. Recurrent lung infection, negative. That is bronchitis. Of cough, I don't have secretion. I don't need to cough. So that one is wrong. And this one is wrong. So the right answer is 1, 2, 3. Emphysema and bronchitis in 30 seconds, right? Number 19, NS is caring for a client with acute asthma exacerbation. Which of the following prescription the nurse should anticipate? Once again, go with your content. Acute asthma. I have acute asthma. I got to fix something fast acting. If the answer choice is not fast acting, I'm not picking it. Ipratropine, fast acting. Theophylline is a long acting. Montelukast is a long acting. Someterol, long acting. Zulatin, long acting. All this is irrelevant. This is a bronchodilator. It's a metaxanthin. You don't use it for acute situation. Montelukast is a leukotriene. You don't use it. Zulatin, leukotriene. You don't use it. It's a long-acting beta agonist. You don't use it. Number one, only one answer choice. NS is caring for a client with SIADH. Which of the following the nurse should include in the plan of care? Once again, content, just one word, SIADH. That means you holding on to your water. Key fact, hyponatremia. So what should I know? Bed in the lowest position. Why? I have seizures, right? Or bed rails are up. I will get seizures. Anticipate an order for D5W. I'm already holding on to my water. Why do I need D5W? I need something greater than 1% to improve my sodium. This is wrong. Anticipate a prescription of demicycline. ADH need to be blocked so that I don't absorb more water. Demicycline will help me. A prescription of desmopressin is another ADH. I don't need another more ADH. So number 5 is wrong, but 1, 2, and 4 are right. NS is caring for a client with myasthenia gravis. Which of the following require priority intervention? Once again, you see, I don't give you a lot of information because I want you to use your content. What do I know about myasthenia gravis? That should be a priority for that, right? These people, they get double vision. It's an expected finding. They have acetylcholine receptor issue where there's competition and they're stronger during the morning and weaker during the night. Therefore, I will prefer my medication in the morning. It's not a priority action. Okay, I have severe weakness. Don't worry about sensitization or I'm sensationalizing the word here, severe. No. At night, it's expected finding. When you have airway problem, dysarthria, slurred speech, that's my priority. So this is the right answer. Number 3, this is wrong, this is wrong, and this is wrong. A new graduate is teaching a 26-year-old client about 1 hour glucose tolerance test. 1 hour. Which of the following teaching indicate correct understanding? This is a trappy question, okay? 1 hour. What do you do when you're doing glucose test 1 hour? That's all. Which one indicate understanding? I would need to fast. Negative is 1 hour. You don't need to fast. I would drink 100 grams of glucose. It's not 100 grams. It's 50 grams. I will need insulin therapy. You don't need it. Test taking strategy. I've cleaned 1, 2, 3. I'll have to pick 4. If your glucose is greater than 140, you need another test to confirm it. It's to need a confirmatory test, a 3-hour test. And let's receive a client in the ICU after a new tracheostomy. Which of the following is the nurse priority action? Once again, I try not to give the answer choice away, give you a clue so that you can master out when you take the NCLEX, you get used to this simple, straightforward, but nothing giving it away. That's how you set questions. ICU, a new tracheostomy. What should be my priority? I don't want the trach to fall out. Replacing the trach tie is a wrong idea. I don't want the trach to fall out. Changing the inner cannula is the wrong idea. I don't want the trach to fall off. I got to check and make sure my one finger can go below so that it's not too tight and it's not falling off. That's the best way. Suction at bedside is good, but it's not better than this is more important. And then caring for a client who is now 24-hour post-total hip arthroplasty. Which of the following actions by the client require priority intervention? All these questions, I've shown you how to answer questions. Start from the back. Which of the following action by the client require priority intervention? What is the situation? 24-hour post-total hip arthroplasty. So that's what I'm thinking of. 24-hour, I have hip arthroplasty. Which one require priority? I've summarized it in my own way. Then I go with my content. I said the most important thing about hip replacement, I should prevent dislocation. Any action that will cause dislocation is wrong answer. Using a walker to walk is okay. Sitting upright is good because I don't want you to bend more than 90 degrees, right? With the leg in the neutral position, excellent. The leg is at the adducted, okay? Leg adduction. So adding and abducting. So ABD is better than ADD. ADD, if you bring the leg together, we get dislocation. When you move the leg apart, that's why we put abductor wedge, okay? Abductor wedge. So that you push the legs from each other. This is not good. Using shoehorn to put on your socks because I don't want you to burn. So that's good. Number 3, needed priority intervention. And next is caring for a client complaining of headache after a lumbar puncture. Which of the following may be responsible for the headache? You see, test taking strategy. We have lumbar puncture and I have headache. Which one will be responsible for that? You know, when we do lumbar puncture, you're going to get headache. Because of that, we give you fluid before and fluid after. So IV infusion before and after is not responsible. This is treating your headache. I have to check and make sure there's no leakage at the site. So a clean insertion site should not be responsible for your headache. You laying flat in bed and your head elevated is good. It's like flat, but your head is up like that. You stay flat. That's good. But if you get up right away after lumbar puncture, you're more likely to get headache. That's why you got to wait at least 2 hours. 2 hours before you get out of bed. Therefore, this may be responsible. She get up too early after the lumbar puncture. That's why she's getting headache. So this one, number 4. It's a little bit tricky question, as usual. This is also tricky, right? A new graduate nurse provide a care to a client with a moderate Alzheimer's on the med-surg unit. The child nurse will intervene if which action is observed. Underline the buzzword. A moderate Alzheimer's, the child nurse is supposed to intervene when I see something. Informed consent is obtained from a spouse. It says moderate Alzheimer's. She can't make decision that she's gone. So spouse is fine. The surgeon obtained the consent before preoperative medication. That's fine. The new graduate witnessed the consent. It's okay. The surgeon communicates using technical terms about the procedure. No, wrong. Layman language. It has to be like 5th grade. 5th grade talking when you're describing things for a patient who needs surgery. 5th grade, not technical terms. I'm showing you what the idea is to show you how to tackle question, go for the keywords, and you see that you analyze the question easily. That's the idea, right? Which action does the nurse take first? So first action, right? Then I go, what is the situation? And nurse is caring for a client. Begin to report of back pain and shortness of breath, 10 minutes during blood transfusion. You're giving the patient blood, right? All of a sudden, 10 minutes, I have back pain and during the transfusion. Do you stop the transfusion? Do you notify the MD? You call the rapid response or you infuse IV. Stop the poison. The poison is always the problem. So stop the poison. This one is a straightforward question, but it's likely people can get confused. So let me call the doctor. Well, fix the patient before you call the doctor because that is easy to stop the transfusion without not doing anything. And this is performing a newborn assessment, which finding need immediate intervention. This one, I just want to test your knowledge and see they can put questions like that, but it's not designed to trap you, it's designed to test if you can figure out some priority information. You have kids, four of them. One have low set years. One has bifurcated uvula. One has absence of a reflex in one eye. And then one of them have acrocyanosis. What do you think? I mean, they are all not good. Okay, I don't want to have this in my baby. But test taking strategy. Who do you think is really bad? That's all. Prioritization is not supposed to be difficult. You look at it and said, if I have 1 second, one second, who do I want to give it to? Do I want to give it to number one with the low set years, number two with bifurcated uvula, number three with the absence of the red reflex in one eye, or acrocyanosis? And then you figure it out. This is not bad. This is not going to, it's not an emergency. It's just the extremities that's like cyanosis. So we can figure it out. Low set years. I know this is what? Down syndrome. Okay. But just because you have low set years, you have Down syndrome. There's a bunch of people walking around with low set years. It does not mean they have Down syndrome. You need to now check other stuff to be consistent. There's so many confirmatory tests that need to be done to make sure this kid does not have Down syndrome. Bifurcated uvula means the kid may have like a soft palate or hard palate problem, cleft palate. But if I don't see a red reflex, hey, they blind. That's bad. Okay, it's an emergency. I got to let the doctor know right away. You see, so that's why number three is much dangerous than the rest. And that's how you do prioritization. And then she's performing assessment on the client with bipolar disorder, which finding need immediate intervention. Once again, as you can see, the theme of the question is concept 101. Bipolar. There's only one word, bipolar. What do I know about bipolar that when I see here, I should worry? Keyword, bipolar, keep your kidney happy. If you keep your kidney happy, everything will be good. What will keep your kidney happy? Dehydration, avoid it. Right? Sodium, avoid it. Right? That is related to the medication they're taking. But number one is dehydration. Hydrochlorothiazide causes dehydration. I'm stopping it. So, enalapril for hypertension is going to affect my sodium. Motrin, your kidney hate it. Bupropion, you may not know this, but bupropion, a bipolar patient, bupropion give you a bunch of energy. It's for depression, but it improve your energy. A bipolar patient already is on top of the world. You should not give them bupropion. You will put them in the maniac state. And then if you're taking what? Twice average daily salt intake, that is what trap people. When you're on lithium, okay, bipolar patient most likely is on lithium. I should make sure my salt is normal. And therefore, I should not do this. Salt should not go down, sodium or should not go up. If you increase too much of salt, we have a problem. I know I did not put lithium there, so somebody would say, The question is flawed. Yeah. The assumption that bipolar, if I have not given to you, most likely they're on lithium. So that is why number five is also included. So all of them is bad problem. It's bad problem. Number 30, a nurse is ready to administer digoxin to an adult, basically, should I say, to an adult client with a heart failure, which finding need immediate intervention. Anorexia, my epical pulse of 65, my creatinine is 1, and my temperature is what? 100. These are some of the questions you see, and you said, what is the key fact? Digoxin, right? For heart failure. There may be answers here that are abnormal, but it has nothing to do with the digoxin. Don't pick it. That's the test taking skills. Temperature is not normal, but does it have anything to do with me taking my digoxin? No. The only three things that you should worry about is anorexia and pulse and creatinine. Creatinine of 1 is normal. It's clear by the kidney clear digoxin. It's not a problem. Epical pulse, you know to know 60, 70, and 90. 90 for neonate, 70 for young, and 60 is for older patient. This is 65, so you don't need to hold it. So it's fine. GI symptoms is number 1. Therefore, anybody taking digoxin with the GI symptoms, you should intervene. So this one, the nurse should do something about it. Anorexia is not good. A nurse received report on a client admitted for pneumonia who is now what? Has a temperature of what? 102.5, heart rate of 110, and blood pressure of that. What do you think is going on with this patient? Which action does the nurse take first? Which action? This is like a case by shortening up. Patient was admitted for pneumonia. His temperature is this 101.5. He's tachycardic and he's hypotensive. Connect the dot. What do you want to do? Vasopressin infusion as prescribed, broad-spectrum antibiotic as prescribed, obtain the culture, and rapid infusion of fluid. Look at it carefully, and this is the test taking strategy. Fever for pneumonia, tachycardic for pneumonia, hypotension. Most pneumonia does not cause all these problems. If I start seeing this, I know this patient is septic, sepsis. It may be going to septic shock. What is the treatment for septic shock? It's not vasopressin infusion. It's not antibiotic. It's not sputum culture. Number 1 is fluid. Shock is what? Hypoperfusion. So improve the hypoperfusion first. IV fluid. After I finished, okay, and they still hypotensive, I give them vasopressin, and then I obtain my culture and give them the antibiotic. So treat the problem acutely first. So they get infusion of normal saline before anything else. And next, a nursing team is made up of RN, UAP, LPN. What action is appropriate for the RN to delegate to the LPN? Delegation 101. I call it MMR most. You should check adapter and class. It will tell you what it means. LPN, right? Monitor most finding of the RN, reinforce teaching, give most medication, do some special tests, take care of stoma. Therefore, admitting a client, I can do that. Preparing a client for something, I cannot do that. But I can administer, this is pure nitroglycerin medication for stable angina. It's okay. I'm discharging a patient? No, because RN evaluates, assess, and teach. So I can do that, but I can give most medication. I can reinforce the teaching. I can monitor most of the finding and take care of stoma staff. So number 3 is okay. It should be delegated to. The nursing team is made up of RN, UAP, LPN in the med-surg ward. What action is appropriate for the RN to delegate to the UAP? When it came to delegation, if you watch my video, I only have 2, 3 words. That's all. UAP, anything that does not require thinking, no thinking, and ADLs. That's all. No thinking and ADL. I don't mean they don't think, but for your test, every answer choice, they are not thinking. You say, go check a virus, go check the virus. Calculate hourly urine output for a client, right? They go and check the urine, they look at the urine and they calculate. This does not require any, right? Assist the client to the bathroom 2 days post. This is ADR. Calculate this one, watch for it. Hourly fluid intake for a client. This, they cannot do it because it requires IV output input, right? So the nurse, medication, and all those things. These are done. The output, hourly output, yeah. But inputs usually involve IV fluid and everything. They are not involved. They don't titrate it. They don't know everything. So this is done by the RN itself. Teaching, they don't teach anybody. And reinforcement, they don't. So those are my answers, 1 and 2. A nurse is caring for a client in labor. The fetal monitor indicates fetal heart rate increased by 15 with each contraction. Words, a bunch of words, just to confuse you. What action is appropriate by the nurse? Rewrite it. Lady is in labor, and the fetal heart rate increased by 15 every time the mommy contract. What does that mean? Mommy contract, baby heart rate goes up 15 every time. What does that mean? It never said decrease, right? This is test taking strategy. I see increase. So something's increasing, it's an acceleration. I never heard say anything about deceleration. Therefore, lateral position, knee is irrelevant. Those are for deceleration. Notify the MD who said, well, don't you know acceleration, you're supposed to do nothing? So number 4 is your right answer. Baby is good. Let's keep on watching labor. That's what he will tell you. Number 35. A nurse is caring for several clients. Which client finding need immediate action? Several clients, 4 of them. Gastric bypass, supine position after meal. Yes, to prevent dumping syndrome. I'm just using content to answer them. If you don't know your content, it will look weird to you. Appendicitis, anheides. I should expect can, so don't worry about it. Cholecystitis, I should expect right shoulder pain. Good. Diverticulitis, I shouldn't expect left upper quadrant pain. That means they have abscess, and that's your priority. A nurse is caring for a client who wants to stop breastfeeding. Which statement by the nurse need immediate intervention by the charge nurse? Which statement? If you want to stop breastfeeding, I'm going for the buzzword. Okay, immediate intervention. Stop breastfeeding. That means the breast, we don't want any milk anymore to be coming out or milk production. We want to stop milk production. Any answer choice that stop milk production is wrong. Always want to know what you're looking for. You see what I did? I read the question. I said, stop breastfeeding. I know to stop breastfeeding, I need to decrease milk production. I should not stimulate milk. So every answer choice that is stimulating milk is a wrong answer. That is what your test is about. Ibuprofen, well, it's going to help with my pain. And where snug feeding support bra, yeah, it was not going to stimulate breast production. Milk. Warm compression, no, it's going to improve blood flow. I don't want that. I don't. That's what I said. I don't want blood flow. So this guy is in trouble. Massaging, more milk is coming. The lady said, want to stop? Making milk. Ice, of course, yes, is going to cause vasoconstriction, and that will decrease milk production. So this does not need intervention. This does not need intervention. This does not need intervention. 3 and 4 need intervention. So that's right. Those are the right answer. But break it down the way you can analyze the question. And then she's teaching new graduate about positive and negative symptoms of schizophrenia. Which of the following is associated with the indicated diagnosis? So sometimes you may know this, but they will use words you've never seen before. That's what I did with this question. Schizophrenia, there's positive and negative symptoms. The best way to know is positive symptoms is what diagnoses schizophrenia. Negative symptoms is all depressive symptoms. Delusion, hallucination, disorganized thoughts. They are positive symptoms. So this one go here. Evolution, you know the answer if I've changed it. But this is what is motivation, lack of motivation. So this is negative symptoms. Anhedonia, what do you think? No pressure, negative symptoms, down going here. Social withdrawal, negative symptoms. Alogia means speech. I don't even want to talk. That's what you see these people. And flat affect. These are depressive symptoms. 38. And next perform assessment of several clients in a prenatal clinic. Which client finding require further assessment or teaching? As you can see, they are pregnant. So you got to know key basic fact about OB to be able to answer the question. So who is in trouble, right? 20 weeks. My uterus is at a umbilicus. That's normal because the pubic is 12 and then your umbilicus is at 12. That's 20. 12 weeks. I've gained 3 pounds. Third trimester, you gain 1 to 4 pounds, 1.1 to 4 pounds. I'm good. 16 weeks, practice downhill in hill skiing. I'm worried that you're going to have trauma. You can exercise, but don't go downhill skiing, right? 22 weeks, your systolic blood pressure increased by 20 since last visit. This you have to know. If the pregnant, their blood pressure increase systolic greater than 30 and diastolic greater than 15, that's bad. This is 20. It's okay. But this guy, you're going to have trauma. You got to figure it out. So this is the case. I will walk you guys through and you'll see beautiful case I said this morning. Interesting. But you already know, I just changed some stuff to trap you. A client on dextromethorphan for cough, right? Did you know this is the medication? Yeah. Present, this is one of the medications you're supposed to know. It's a common medication, so you have to know. Present to the emergency room with what? Nausea, vomit, heart rate of 110, temperature of 101.5, agitation after taking sumatriptan for migraine headache. You don't need any more information to make this diagnosis. You don't need any more information. I've given you everything you're supposed to know for this. This client is taking this medication, dextromethorphan, for cough. He has nausea, vomiting, heart rate, temperature of that, agitation for taking sumatriptan for migraine headache. What condition the client is most likely experiencing and select 2 actions the next. This is the bow tie. Simple bow tie question. Look at it. Can you figure out the 2 medication? What do they have in common? Sumatriptan and dextromethorphan, but all of a sudden have nausea, vomiting, some GI symptoms, agitation, temperature, and tachycardia. What do you think? Can you make a diagnosis from that? That's the thing. Can you make diagnosis from that? And this is a bow tie. Is this a neuroleptic malignant syndrome, malignant hyperthermia, serotonin syndrome, extrapyramidal side effect? A lot of people always have a problem with this. kind of question. Look, sumatriptan is a serotonin derivative. Dextromethorphan is also serotonin derivative. So you have two serotonin together. If you can't figure out, signs and symptoms are going up. It cannot be extrapyramidal symptoms. You don't have tardive dyskinesia, akathisia. Oh, so this is gone. It cannot be malignant hyperthermia. The patient did not have surgery. And then you left with 1 and 2, serotonin syndrome and neuroleptic malignant syndrome. Even if you don't know, I'm showing you how to answer this question if you have no clue. Neuroleptic malignant syndrome is due to antipsychotic. There's no antipsychotic on the screen. This question is not hard. It's a bunch of words I put together. Your NCLEX would do that. You see them in Cuba. It's not hard. It's just I put a bunch of words. You say, oh, what is this? I just analyze it and you can see like there's no antipsychotic. Therefore, I'm not going to pick neuroleptic malignant syndrome. There's no antidepressant either. So you say, okay, how about serotonin? But look at it. There's no patient never had what? Surgery. It cannot be malignant hyperthermia. Patient is not taking antipsychotic. It cannot be extrapyramidal side effect. Therefore, if I've eliminated 1, 2, and 3, I'm left with serotonin syndrome. I have to pick it. It's not all the time they will give you SSRI plus something. This medication is one of the common medication that causes serotonin syndrome. Sumatriptan is a serotonin derivative. The two, don't combine them together. I give you symptoms of going up. Therefore, this is serotonin syndrome. And this is the way you answer both times. You find the diagnosis, then you can know how to treat it. To treat it, attack the problem. It's a serotonin, block it. Cyproheptadine will block serotonin, and then you calm them down with diazepam. What you watch for? Signs and symptoms of serotonin. That's what you monitor for. Their deep tender reflex, as you make sure it's not going up. Their jaw is not going to get locked. That is malignant hyperthermia. Lip smacking is extrapyramidal symptoms. And cluness is signs and symptoms of serotonin syndrome. So deep tender reflex and that are your right answer. This is serotonin syndrome and cyproheptadine and diazepam. A good question, adapt NCLEX way, help you test taking strategies. Think through it. You can see that a bunch of words, but it's not hard. Same thing. If you don't know this, it's fine. This is a content you have to know, be able to. But there's 2 words in there. A client with severe, that is the buzzword, COPD, present to the emergency room with what? New onset of shortness of breath and CVP of 25. A palpable liver. I'm trying to give you enough information not to make this question hard. The patient has no crackles, no wheezing, and chest pain. What do you think? Break it down. I have bad COPD. And now, shortness of breath, I have CVP of 25 and palpable liver and spleen. Forget about the COPD. Think about this. If I have CVP of 25 and a palpable liver and a spleen, and I give it to you, what do you think is going on with this patient? What do you think? Central venous pressure of 25 and liver and spleen that are big. You should be able to figure out what is going on with this patient. This is a right-sided heart failure. If you have lung problem, severe COPD, and all of a sudden you have right-sided heart failure, it's what we call core pulmonary. Anybody with bad COPD now develop heart failure, mostly right-sided, is that. And therefore, you just treat the heart failure. You get ethacrenic acid, which is a loop diuretic. They don't get epinephrine. It's going to worsen the condition, limit their sodium intake. This is not COPD, therefore, they don't need to have breathing technique. You check the electrolyte because you're giving them diuretic, you monitor their weight. There's no breathing precaution or fever. But this is my way of making you think. If you see this next time, I know you won't forget it. Call pulmonary. If you never heard it before, check the adapting place. 41. And then receive an order for to place a matters test on a client. Which client statement require further evaluation? This is a good question. It's a concept you're supposed to know. And I just made it in the question. This was supposed to place matters test. You got to know what it is. This is PPD test on a client. If what did he say that should disturb you? Say, hey, I got to do something. What? I'm homeless. I'm 8 weeks pregnant. I have an influenza vaccine 1 week ago, the IM form, or I have 15 millimeter induration from skin test 2 years ago. People always forget it. Don't forget today. If you need to place a PPD. If you're homeless, it's not contraindicated for that. If you're pregnant, yeah, you can get a PPD. If you receive live vaccine, you have to wait for 4 weeks. IM vaccine of influenza is not live vaccine, so that is fine. The kid or whoever had 15 millimeter induration, this is positive PPD. You allow one test in your lifetime to be positive. When you get positive, you should never get any more PPD. So this patient doesn't need to get any PPD test. So this one need further evaluation. Should not get any more PPD test. And this is caring for several clients. Which client statements require further teaching? This is my favorite questions of all. A trappy one. They all say consistent fresh leafy vegetables while I'm taking enoxaparin, while I'm taking dabigatran, while I'm taking Coumadin, while I'm taking Rozobam, while I'm taking clopidogrel. Which client require further teaching? Look, I don't need to have a consistent leafy vegetable while I'm taking enoxaparin because diet is a trap. Diet is not indicated. So I don't need diet modification. Dabigatran, I don't need to take any diet problem. I don't need to change it. Coumadin, yes. Rivaroxaban, I don't need to. Neither if I'm taking Plavix, I don't need to. So 1, 2, 3. You just have to be who you are. You don't have to eat them. Yeah, there's no diet restriction. There's no strict diet problem. So diet is not an issue. You don't need to teach them about diet. That's the idea of this. If you're teaching them about diet, that means you don't know that that medication causes diet problem. It has diet effect. And next is caring for a client with severe Alzheimer's disease. Which client finding is consistent with the diagnosis? Don't go and take the NCLEX without at least knowing something about Alzheimer's, the different types, the more mild, moderate, and severe, and what each constitute. At least one question will show up. I've not taken the NCLEX before, but I mean, I'm not a nurse, but I'm just telling you, at least this is one disease process, is common board exams, like something about Alzheimer's for once will show up, right? But when they ask you, the best way to answer is put them in the category. Is it mild, moderate, severe? Then you know what it is. Mild form, they have short-term memory, so they will forget they eat at all. The moderate, They will forget that meal was consumed. They forget how to use utensils. It's moderate. But dysphagia, they are severe. They get you. So this is a severe form. And so that's number two is your right answer. A severe form, they will develop dysphagia. And I like this. I thought about it and I just made it up. And then since evaluating a client, I just want you to pay, well, I mean, if you get a chance to watch this video, as I'm not sure. Which client with acute onset of what? Visual field loss and pain. Evaluating a client with acute sudden onset of visual field loss and pain. Which client finding is consistent with the diagnosis? Acute onset, and I have pain and the visual field loss. Look at it. Best way to answer this, which of these causes pain and which does not? Macular degeneration, no pain. Cataract, no pain. Then you'll be left with 2 and 4. The 2, this is the key buzzword. Open angle glaucoma is not painful, it's painless. Therefore, you know the answer, retinal detachment. And this is teaching you graduate about difference between osteoarthritis and rheumatoid arthritis. That's musculoskeletal. You can see that these 46 questions is comprehensive. We cover every system that you're supposed to know for your NCLEX. I just pick one answer from whatever came to my mind. Which of the following is associated with the indicated symptoms? Do you know the difference between these two? That's all. Which one is unilateral symptoms? It's osteoarthritis. Rheumatoid is bilateral. Which one you need NSAID? Osteoarthritis. Which one you need adalimumab? Is rheumatoid. Which one involves small joints? Rheumatoid. Which one is both sides? Rheumatoid. Which one they have decreased joints? Both of them. And which one has morning stiffness lasting less than 30 minutes? It's osteoarthritis. For rheumatoid, they also have morning stiffness. Watch it, it's a trap. But it's greater than 60 minutes. It lasts for an hour and several hours. But in osteoarthritis, you just need, it's less than 30 minutes. So that's why that one is for osteoarthritis alone. I think there's 2 more questions left, or one. Yeah, there's one. And I saved the best for the last. Do you want to master your prioritization? You should check out that NCLEX videos. You should subscribe for it. But prioritization should not be that. Like I said, you got to be sharp. Breathing problem, electrolyte, shock, sepsis, airway, and there's disease condition. The key thing is not to just memorize ABC. The key is look at the situation and see what is happening. You can have CHF, but you will never be a priority. You can have asthma and still not a priority because of the situation. If an asthma patient, I give you an albuterol and your heart rate is 110, it's an expected finding, right? But if an asthma patient is still wheezing or no wheezing after you give them albuterol, it's a problem. Those are the things. They're not going to tell you ABC. I know there's a bunch of acronyms there, but I want you to be like very careful when you're reading prioritization and make it easier. So just divide the thing. Look at the situation and the modifier they're telling you. You have glaucoma. I give you diphenhydramine for pruritus. What do you need to know? 3 things. Anybody with the glaucoma, you should avoid what? Anticholinergic, antihistamine, and then anti-decongestant or decongestant. Three things. I see diphenhydramine. I'm picking you. 8 weeks pregnant. You eating fresh vegetables and some hot dogs. We have a problem. You see, there's no ABC there, but it's a concept, an expected finding, and what you need. Guillain-Barré syndrome, you can have leg weakness, you can have ascending paralysis, you can have whatever, but if you have dysarthria, that's the airway, slurred speech, that's your priority, that's the holy. Anorexic patient, you give them bupropion, they're not going to eat. You should avoid it in anorexic patient. Parkinson patient, you give them flufenazine. Flufenazine is a first generation antipsychotic. What does they block? Dopamine. Parkinson patient, what do they need? Dopamine. We have a problem. Pancreatitis patient with bruises around the umbilicus. You know it, right? That's Kellen sign. And diabetes patient with glucose of 200. Good luck. A bunch of people walk around with glucose of 250. I'm not picking you. That's why Bishop, he said hypoglycemia, not hyper. This is not the problem. This is adapting class. Thank you for indulging me.